So, in the series of lectures of infectious diseases of medicine, today I will be discussing about the chickenpox. So, what is basically chickenpox? So, it is infection which is caused by varicella zoster virus. So, chickenpox is caused by varicella zoster virus. Varicella zoster virus is also called as human herpes virus type 3. Actually, it is a DNA virus, right? So, varicella zoster virus is DNA virus. So, how the chickenpox is transmitted? Chickenpox is transmitted via respiratory droplets, which results in the formation of vesicles. Later on, these vesicles erupted and it forms the crust and scab. We will be discussing later in detail. So, what is the most common mode of transmission of chickenpox? That is airborne. So, airborne transmission is the most common mode of transmission, while less common mode of transmission is direct contact. So, through direct contact, chickenpox can be transmitted, while transplacental route and pregnant women. So chickenpox is transmitted by three ways. The most common mode of transmission is airborne, the least common mode of transmission is direct contact, and pregnant it is transmitted by transplacental route. Now what is the infectivity period of the chickenpox? So what is the infectivity period of chickenpox? So 2 days before the appearance of rash, 2 days before appearance of rash, and up to 5 days, up to 5 days after onset of rash. So what is the infectivity period for the chickenpox? 2 days before the appearance of rash and up to 5 days after onset of rash. So this is the infectivity time frame period for the chickenpox. While if we talk about the incubation period, what is the incubation period for the chickenpox? The incubation period for chickenpox is 2 weeks. What is incubation period means? Incubation period means that if someone is suffering from varicella zoster infection, so up to 2 weeks there will be no symptoms, but after 2 weeks the patient get enter into prodromal phase. So what is prodromal phase? In prodromal phase, the patient give you a chief complaint of fever, malaise, and severe body aches. So it's very important. The prodromal phase consists of fever, malaise, and severe body aches. After prodromal phase, there is exanthum phase. Began to appear. Rash began to appear in exanthum phase. This rash first it appear on trunk, then it spread to face and scalp, which ultimately involve the extremities. But sometimes it can also appear in oral mucosa, genitalia, and palms and soles. Now the most important is what is the pattern of rash. Now let's talk about the pattern of rash in the chickenpox. Now these rashes first it appear as a macule. These rashes it first appear in rashes first appear as macule, then it becomes papule, and ultimately it becomes vesicle, right? So what is macule? Macule is a flat lesion having diameter less than 10 mm, and papule is the raised lesion having diameter less than 10 mm, while vesicle are the raised lesion having fluid and having diameter less than 10 mm. I already make a detailed video on basic skin lesion, so I will also provide link in the description. You should watch that video as well. So the rashes that appear in chickenpox, the pattern is first it appear as macule, then it becomes papule, and ultimately it becomes vesicle. Now the vesicle which appear in chickenpox, it has erythematous base, right? And the vesicle which is appear in chickenpox, that vesicle is called as teardrop vesicle. Teardrop vesicle. What does it mean? It means these vesicle, they have erythematous base, right? They have erythematous base, and over that there is vesicle. So the base is red and over that there is vesicle. Now when these vesicle it get erupted, so what happens? When vesicle erupted, then it forms the crested papule. Then it forms the crested papule, and this crested papule it lead to severe pruritus. It lead to severe pruritus, severe itching. Upon scratching, the lesion erupted prematurely, and there is superseded bacterial infection occur. Right? There is superseded bacterial infection is the first main complication for the chickenpox. So it's very important you have in your mind that the most common complication of chickenpox is superseded bacterial infection. What is the second common complication? The second complication of chickenpox is reactivation is shingles. If someone is suffering from varicella zoster infection, so after many years later, these patients come to you with a complaint of sudden chest pain along with the vesicular rashes in the dermatomal region of chest, but that does not cross the midline. So it's important. It means that in primary infection, the varicella it present as chickenpox, but in reactivation infection, the varicella present as shingles. Right, so it's the second complication for the chickenpox. The third main complication is pneumonia. So what are the main three complications of chickenpox? That is superseded bacterial infection, reactivation as shingles, and pneumonia. Now what are the investigations? What are the investigations? So clinically you can easily diagnose chickenpox, but for academic purpose you have to know that what are the some other approaches. So if one asks you what is the best initial test for chickenpox, so what is the best initial test? Zinc staining, that is zinc smear. So zinc smear is the best initial test. Sample taken from vesicle and that stain under microscope. And microscope you will see that there is multiple joint nucleated cells. That is called as Cowdery bodies. So under microscope you will see Cowdery bodies. Right? So the best initial test is zinc smear, while the best confirmatory test is for chickenpox is PCR. Treatment option. How you will treat the chickenpox. So based upon treatment, we categorize the chickenpox into two categories, and for the children and for the adult. So for the children, we don't do any specific treatment, we do supportive care. In children, we do supportive care. We don't need to give antiviral therapy. Say if a child presented with pruritus, so in that condition, you have to give the cetirizine. So if child presented with pruritus, so you can give cetirizine. You can also give calamine lotion, promexine gel, promexine gel. So the cetirizine, calamine lotion, and promexine gel, these are the options for the pruritus. And for the fever, you can give paracetamol. Also, you will advise that the fingernail should be clipped and avoid rubbing and avoid the sun exposure. The child is at high risk of complications. So in that condition, we can give antiviral therapy. So in that condition, we can give the oral acyclovir. Oral acyclovir, and the dose is 20 mg per kg QID 5 days. Also, we can give oral well acyclovir 20 mg per kg and TID dose for 5 days. If the child is at high risk of complication, then at that condition we can give the oral acyclovir on oral acyclovir and with the dose of 20 mg per kg. Now, if the patient is adult and that condition, we have to give antiviral therapy. Now, antiviral therapy, it should given within 24 hours of rashes. This is well acyclovir 1 gram TDS or oral acyclovir 800 mg 5 times in a day. So if the patient is adult, so we have to give antiviral therapy, and the option is well acyclovir and oral acyclovir, and the dose is 800 mg for the acyclovir 5 times in a day. Now, what we have to give in immunocompromised patient? An immunocompromised patient, IV acyclovir 10 mg per kg IV every 8 hours, right? So it is for immunocompromised patient. And immunocompromised patient, it increase the risk of disseminated varicella zoster infection. What are the preventions? How we will prevent chickenpox? Approaches: primary immunization and combine MMRV vaccine. So for the prevention of chickenpox, we have primary immunization and combined MMRV. So CDC recommend 2 doses for the chickenpox. So the first dose should be given on 1 year, while the second dose should be given in 4 to 6 year, right? According to CDC, they recommend 2 doses. The first dose should be given on 1 year, the second dose should be given on 4 to 6 year. Usually the first dose, it is sufficient for lifelong immunity until unless the patient gets severely immunocompromised, right? So it's important. So it is for primary immunization, while the second approach is combined MMRV, and that is measles, mumps, rubella vaccine. That is combination of exposure prophylaxis. And post-exposure prophylaxis, what does it mean? If patient did not have common pox in childhood, but that patient continuously and repeatedly in contact with the infected person, so there is increased risk of infection. So in that condition, we have to give certain immunization in the form of active immunization and passive immunization. Now, active immunization, it is given 5 days following exposure. So it is given 5 days following exposure, while the passive immunization, it is given 10 days following after exposure. Usually the peso immunization, it is done by varicella zoster immunoglobulins. So through immunoglobulins, we do peso immunization, and that should given 10 days post exposure. And peso immunization, it is mainly done in children, pregnant, and immunocompromised patients. So that's all for